Welcome to today's Resiliency call, Digitizing the Patient Experience, with Dr. David Boston, cardiologist. This call closes out our 5-part series of resiliency and digital health, which we posted throughout the month of June. I'm Riley O'Brien, Vice President of Events Experiences at TAO. I'll be working the back end of this Zoom, so if you have any questions, feel free to send me a message via the special events tab. A couple of rules of engagement before we get started. All participants have been muted. We ask that you remain on mute until a TAO staff member unmutes you and calls on you to talk. You may ask or respond to questions directly into the chat box or by sending a private message to Jen or myself during the discussion. And we ask that you engage using the participant icon. You can give a thumbs up or yes or a no throughout the event. We invite you to engage with us on social media during the call and throughout the day. We'd love to share what's happening with TAO and get participant takeaways from all of our events. Due to limited time, we're going to capture all the questions in the chat and shift any unanswered questions to Mobilize. Mobilize is TAO's member-only virtual community, and all the questions will continue there, as well as more conversations about digital health and other things that we're working on as an association. If you have any questions about joining Mobilize, you can reach out to Justin Martinez on our team, or you're welcome to reach out to membership@techoregon.org. A huge thank you goes out to Jen and OCHIN for underwriting this series. We really appreciate their sponsorship and have greatly enjoyed exploring topics related to digital health. And finally, it is my pleasure to introduce Dr. David Boston and OCHIN's Executive Vice President of Government Relations and Public Affairs, Jennifer Stoll. Jen and David, the floor is yours.
Thank you, Riley. Good morning, everyone. Thank you for getting up with us this morning. For those of you who don't know me, I'm Jen Stoll, Lead Government Relations and Public Affairs for OCHIN. And for those that may not know OCHIN, we are a national nonprofit. We're headquartered here in Portland. And our mission as a health IT and research collaborative is to support underserved communities across the country have access and be able to implement and use best-in-class technologies and to deliver better outcomes for patients. Today, we have with us Dr. Dave Boston. Dave, as Riley said, is a practicing cardiologist at PeaceHealth, and he is also a clinical informaticist here at OCHIN. And he leads our telehealth program. And we're very lucky to have Dave here today to talk to us about what he's learning around COVID, and specifically after we've had a chance to have ongoing discussions about how our healthcare community has really been extraordinarily resilient during the COVID epidemic. And even more so today, as when we started this, it seemed like we're managing to get the COVID epidemic under control. How do we continue to innovate and use data to understand how to handle COVID flare-ups as they will continue and be with us in the future? So, good morning, Dave. Thanks for joining us.
Good morning. Thank you all for coming. Thanks for having me.
Excellent. Hey, well, I would love to have you start and just tell us a little bit about yourself, your background, and what you're seeing so far.
Sure. Thanks. I've been a practicing internist and cardiologist for many years now. I've been practicing in the community here for 20 years. I've been a clinical informaticist at OCHIN for a couple years, and I've been medical director of virtual care, as Jen pointed out. So I have been witness to this amazing change that's occurred in the past few months. And really, if you think about it, it's easier to delineate the things that haven't changed than that have. Every thing in our lives has been upended. And I've seen that through multiple lenses, from the OCHIN lens, looking at just how rapidly things have changed with the adoption of virtual care and how healthcare is delivered in this country, to my own sitting at a computer and doing video visits, doing telephone consults, and then just seeing what's going on in the world around us. If I may, I'd like to share my screen and just show you what we're finding at OCHIN, which mirrors what's going on in the rest of the country. I'm going to go ahead and share this. So you can see here, this is starting back from March, and these are the number of in-person and telehealth encounters. So in-person is in this kind of light gray and telehealth in yellow. And like most of the rest of the country, we did very little telehealth at OCHIN. It represented nationally less than 1% of all encounters, not just with us, everywhere. It really was what literature and data is available was kind of confined to relatively closed systems, integrated systems, academic centers, and so we really didn't have a lot of experience doing this. But you can see as things started shutting down in mid-March, this yellow curve starts rising and becomes a greater and greater portion of the total encounters, as all encounters decreased initially. A couple of interesting things about this is that this has stayed despite the fact that people are coming back to in-person visits, and that still about half of all of these are in-person encounters. So an interesting kind of initial response, which really does point out the resiliency and why we're here talking about this, is how rapidly folks went from no capacity to do this, zero, no video, looking for cameras, looking for connections, wires, workflows, nothing, to within a month being able to do this many is truly incredible. When you break it down by type of telehealth encounter, what we're seeing is that most of these are what we call telemedicine or other. They are typically video visits that are not integrated. And I'll talk about a little more about that in a minute. Phone represents this blue-gray. The white is telemedicine other, which, like I said, is typically a, when we first started this, they let you use any platform you wanted to do video. And that has persisted because it's simple, readily available, and points out that again, people will find what they need to do to see patients, to take care of patients, to get their jobs done. And the little yellow here is our integration of video visits, Zoom within Epic. And you can see that that has grown percentage-wise from the beginning, but still remains as a smaller percentage, just because, again, there's a technology and access barrier there that doesn't exist when things are just done on the fly. But I think that's starting to level off as we improve that access. I'm happy to talk more about that in a bit. And finally, I just wanted to point out this slide showing behavioral health. So same kind of thing, just what were face-to-face encounters all up until March, and how much this has affected behavioral and mental health encounters, now becoming half of all visits, and really kind of a bellwether of what we need to look at in the future. This is a technology that is greatly enhancing our ability to reach patients and address their behavioral health needs like never before. So just huge things. In my practice, it's mirrored very similarly. Telephone, video, but face-to-face encounters are returning, and we've seen that in the press too. So something to look out for as we look toward how much this goes back to, quote, normal pre-COVID, and what we retain and how we do that.
Thanks, Dave. Hey, you mentioned a little bit about Well, actually, let me back up. For those that may not know what a clinical informaticist does, can you help us understand, what that is, and what are you looking at as a clinical informaticist, and how does it fit into the healthcare system?
Sure, that's a good question. I look at it as, you have your healthcare delivery, humans doing what has historically been an entirely human interaction task, and then the computers, which have infiltrated all aspects of our lives and has somewhat lagged behind in medicine, as famously reported for decades behind airline safety and countless examples of how the digital revolution was lagging behind in medicine. So for informatics, it's about melding that. It's about using what we know about clinical medicine and the historic delivery of that with the best aspects of digitalizing all that and operationalizing it so that it becomes a seamless and an improvement over the way we practice medicine because of the ready availability of data and documentation.
Thank you. I wanted to go back to one of the comments that you just said about video visits coming back a little bit. Tell us why you think that that's the case. And, is there, how do you think telehealth is going to fit into the larger conversation for healthcare delivery in the future?
Yeah, video visits, I think we've gotten over the barrier of this is scary new technology that that is going to be hard to implement. And that's obviously not the case. We're seeing every one of our clinics and all over the country and world are adapting to this and easily, I think, adding video. So that barrier is gone. And we're learning that it's actually also, a very useful tool for healthcare delivery. I think there's a lot of skepticism and there still needs to be a lot learned. We don't know how this affects healthcare in the long term. So I think we're learning a lot about it, but initially we've learned that it's a relatively easy to implement tool, easier than we thought, that it works better than we thought, and that it is going to be a critical tool within the toolkit of what we do to get access to people, to deliver care when we can't due to distance and time. I think, Jen, are you there?
Yes.
Can you hear me? Okay. So that's basically what I have to say about video. The interesting thing, the one interesting other comment is that we've found that we embedded Zoom into our EHR, which is the most secure way of doing it. And we found, though, that it was adoption rates were difficult. And so what we've learned about that is that we really do need to lower barriers further, and we've taken out some the necessity to room the patient, to even to admit the patient like as a regular encounter. We've sent links out to patients so they don't have to necessarily find it through their portal, and gone around the portal to provide this. So we're trying to find ways to make it as easy as possible for patients, but we really need to think about health and computer literacy when we look at how to provide video going forward.
Great. So, I mean, you're touching on inequities, right? Essentially, and some disparities and inequities in healthcare delivery. Talk to us a little bit more about that. What do you see in that space that we might be able to overcome as technology association?
Yeah, I think we're at a shocking crossroads. We've seen the data about COVID-19 and its disproportionate effect on Blacks and Black communities, and how social determinants of health affects uh, the consequences of that. We already know that through chronic diseases, that there's a big disparity in that. And we're at a precipice of providing virtual care as part of, again, a whole toolkit of healthcare delivery. And we need to make sure we get this right. We need to think about this healthcare disparity and social determinants of health every step of the way. And so that includes making sure we have broadband capabilities, making sure patients have the necessary components to do what they need to do and can access providers, not just in their community, but potentially all over the state, over state lines. We need to just open this up and think about really, like, how can we deliver care equitably to our society, because we're in real danger if we don't, of just having this, again, just bypass those who don't have those benefits, and just tailoring everything to those with the best insurance and the most money, and that's really, this is an opportunity to actually do the opposite, to really reach communities that we failed to deliver equitable health care for.
Thank you, Dave. Great point. Are there other technologies that you're looking at, or any other data sets that you want to speak to, especially as it relates to the work that you're doing?
Yeah, so we have we just put in a couple of research proposals. We're doing a research study on cardiovascular health. And we want to see, we put in a proposal for an extension to see what's happened with virtual care in terms of people managing their own cardiovascular health. Are they still taking their meds even though they haven't, seen a physician? Are they keeping their video appointments? How are they doing? And how is this impacting chronic disease management? That's just one of several studies. There's ongoing social determinants of health research. We want to look at how that impacts virtual care adoption. And so early days, we're looking at just exactly what impact this is having. And in terms of innovations, I think we've seen a lot of attention on telephone and video visits, but there's whole other sections of virtual care that that are blossoming that haven't really been called to the front yet. A lot of asynchronous care options out there. We still know that e-consults are greatly underutilized and offer the promise of truly equitable care. There's electronic visits, remote patient monitoring. We're looking at a study getting funding for a remote patient monitoring investigation, and this, I think, will be critical in improving things like hypertension, which we're failing at as a country, and so I think what we're going to see innovation is in those automated, algorithmic and asynchronous platforms where there's lots and lots of innovation happening.
Great. Great. And I want to encourage everybody who's listening to please enter any questions into the chat that you might have for Dave. Love to incorporate your thoughts into this conversation as well. It's funny because I just see Riley said the same thing in the chat. So Dave, I know you've been working on some projects for OCHIN looking at specialty referral rates, and specifically how often a patient within the OCHIN network actually closes an encounter to a specialist. Can you talk to us a little bit about that and how that fits into the larger conversation around healthcare delivery and resiliency?
Sure. So as you can imagine, since we're a organization that that provides an EHR, a single EHR for many safety net patients across the country. We can track how long it takes for them to see a specialist, and what those referral rates are, and how often they get closed, so they're seen successfully. And it's pretty dismal. We're looking at probably 40 to 50% success rate in achieving a consultation. Maybe only 75% gets scheduled with a specialist, and those that do are fortunate enough to be scheduled, that there is a long wait time, longer than in the private sector. People wait a median of 75 days even to get scheduled with a neurologist, for instance, and that's just, you know, unacceptable to have to suffer with a headache for that long, or something more serious potentially. And we know that that's a lot of that has to do with the type of patients we have, their challenges. They're located often in areas where there aren't adequate specialists, and they often don't have insurance coverage that is adequate. So there's a lot of things to address there, but I think there is a real technological solution with electronic consultations with those. I think that's the next big frontier, because there really is no reason why somebody in Portland can't do an electronic consult on somebody in Eastern Oregon, and I know that there are people doing that now. So I think, and there's no, you know, there's no factor based on race or socioeconomic class. These are consultations between providers. So we're really focusing on trying to improve specialist access through referral networks, and looking for funding mechanisms for investigating that.
Great, thank you. There's a question from the chat, which I thought was a good one. Is there a way to make health data available across systems? This person said, love being able to access my health information online, but it's frustrating not to be able to share with all the data. So it's an interoperability question, and love to get your take on that.
Sure, yeah, that is a vexing problem. That's been a stumbling block since all these EHRs were grown and developed, and they all kind of siloed themselves, and so we're building bridges back, and aggressively doing so through care quality and an Epic, the Care Everywhere network, and it's improving all the time. It's much easier to send a data set between health systems, and so that's an improving, and I think going to be greatly improving situation with the 21st Century Cures Act. You know, by 2023, any patient can have complete access to their entire medical record. So they will be able to obtain and transfer and provide and do all that, and that's kind of a exciting and scary development, but that will get better. That will continue to get better. That's a huge focus. Great question.
Great. And so there's another question from the chat. What are some approaches used in protecting and securing data, especially during remote patient care? So how do you protect patient data during a telehealth or virtual care encounter?
Yeah, that's a great question. And you know, there really should be end-to-end encryption for any communication between patients and their providers, their healthcare team, the hospital. Many of these are in relation to the question right above it. That's the advantage of the Zoom integrated within Epic. It was just it was literally Zoom bomb proof, and provided a password, was very secure, and so But it also, those security extra security features also generate potential barriers to access, as you know, as we all remember or try and keep track of hundreds of passwords, because they should be different and they all should be hard and to remember or to guess. So the same kind of thing here. The more you lock this down and make it restrictive and safe, the harder it is to get into. So we're looking for that balance, but I'm not terribly concerned about this part. I still think most breaches are at the end, at the user level. So I'm not terribly concerned about the technology being being breached in transit.
Great. Well, in our last few minutes, I'd love to get your thoughts, Dave, on, in terms of healthcare and healthcare data, where do you see, and technology, where do you see this, the ship evolving over the next year? And then maybe if you're, as a futurist instead of an informaticist, looking into your crystal ball and tell us where we're going in the next 5 years in terms of healthcare delivery. Not that anybody could have predicted COVID coming in and rocking our boats this year, but love to get your thoughts on where we're headed.
Well, I should turn that question back to you, Jen, because I think it's going to be where the money is. It's going to be what is going to happen to reimbursement, because that is always an issue on what gets adopted. And so if we can get payment parity, or at least payment equity for doing telehealth, and if we can demonstrate the value in that, which I think is already being done, then I think we can look forward to a future where healthcare delivery is all of this. It's face-to-face, it's video, it's telephone, it's automated, it's asynchronous, and they kind of flow together, and we learn how best to incorporate all that. But if we can't practice across state lines, if we're restricted, it's too hard to get licenses or accreditation. It's too hard to get paid. Then those innovations, that's just how the healthcare system works here. That's how that's how it all works here. It's going to follow what can be achievable and sustainable. And so we are thankful and look to you to help push that piece, because that's of critical importance for where this goes.
Thank you, Dave. We really appreciate you spending some time with us this morning. And this concludes our Resiliency series at the Technology Association, and how the healthcare delivery system has really risen to the challenge during COVID. And again, whether it's a fire or an earthquake or tsunami or COVID, we've learned a lot. And we as a healthcare delivery system really need to be applauded, but we have a lot to still do. And really thank you for your time, and thank everybody for being part of this Resiliency series. And Riley, I'm going to turn it back to you.
Thank you
Thanks,
so much, Jen and Dave. Really appreciate this conversation this morning. As Jen says, that concludes this Resiliency series, but we have other programming coming up. So we invite everyone to take a look at our website, which is techoregon.org. If you do the / and do events, you can find other programming that we have available starting in July. Thank you again to Jen and OCHIN, and we hope you all have a really great Tuesday.
Thank you.
Thank you all.